Every man thinks he understands his body, until the facts say otherwise. What if I told you that your daily habit, one that seems harmless and even comforting, could actually be slowly undermining your health? Not tomorrow, not next year, but right now. Masturbation is a private ritual for millions of men, especially as they grow older. But few realize the complex web of hormonal reactions, prostate function, and long-term risks involved. This isn't about shame or outdated morality. This is about science and survival. Studies from institutions like Harvard have uncovered shocking links between ejaculation frequency and prostate health. At the same time, researchers are warning about an epidemic of pornography-induced dysfunction and silent inflammation that may go unnoticed for decades. The truth: masturbation is not neutral. It can heal or it can harm. In this video, we'll take a deep dive into what the latest science says about daily masturbation, how it affects men over 40, and what you can do to protect your body and mind. You'll understand the real story behind your prostate, the hidden signals your body is sending, and the lifestyle shifts that could save your life. If you think this is just about pleasure, think again. This is about your health, your energy, and your future. If you're serious about taking control of your body and staying sharp as the years go by, you're in the right place. Don't forget to subscribe to the channel. Here, we talk about the things men need to know, but few dare to say. Throughout human evolution, the male body has undergone complex adaptations to ensure survival and reproduction. One of the most significant yet often overlooked organs in this system is the prostate. While small in size, the prostate plays a critical role in male fertility and overall health. Its function evolved not only to support reproduction but also to provide protective mechanisms that enhance a man's chances of passing on his genes effectively. The prostate produces a fluid that becomes part of semen, serving as both a protector and transporter of sperm. This fluid helps neutralize the acidity of the vaginal environment, allowing sperm to survive longer. Beyond reproduction, the prostate contains substances that help fight infections, making it a key player in the body's immune response. In essence, the prostate is not just a reproductive tool, it is also a silent guardian of internal balance and protection. Hormonal interactions are deeply tied to the prostate's health. Testosterone and other male hormones influence its function directly. When hormone levels drop or become unbalanced, men may experience lower libido, fatigue, and even emotional changes. The state of the prostate often reflects the broader state of male hormonal health. That's why paying attention to its signals, discomfort, changes in urinary patterns, or reduced sexual drive, is essential as men age. As the male body grows older, the prostate naturally enlarges, which can lead to health complications if not monitored. Understanding the evolutionary role of the prostate helps demystify its importance. It's not just an organ that causes trouble later in life. It's a vital part of what keeps the male system running smoothly. And it deserves the same level of care and awareness that we give to other major aspects of our health. Ejaculation may seem like a straightforward event, but biologically, it's a finely tuned process involving multiple systems working in harmony. It begins in the brain, where sensory stimulation triggers a cascade of neural activity. These signals travel down the spinal cord, activating a complex network of muscles and glands. The prostate, seminal vesicles, and vas deferens all contract in sequence, propelling semen through the urethra. It's a mechanical symphony designed over millennia to be both efficient and precise. One of the main contributors to the semen's composition is the fluid produced by the prostate. This prostatic fluid is rich in enzymes, zinc, and citric acid, substances that nourish and protect sperm. It also helps to liquefy semen after ejaculation, making it easier for sperm to move. Without the prostate's involvement, the entire process of ejaculation would be compromised. It's not just a passive participant. It plays an active, essential role in the outcome. After ejaculation, the body goes through a series of hormonal shifts. Dopamine, often associated with pleasure and motivation, spikes during the act. But it's followed quickly by a rise in prolactin, which creates a feeling of satisfaction and can lead to temporary fatigue. Oxytocin also increases, promoting a sense of bonding and calm. These hormonal changes are not random. They are part of the body's way of regulating sexual behavior and encouraging rest and recovery. Understanding these biological mechanisms is crucial, especially for men over 40. As the body ages, changes in hormonal levels and prostate function can affect the quality of ejaculation and the overall experience of sexual activity. Recognizing how these systems interact helps men make informed decisions about their health and encourages proactive care to maintain both physical and emotional well-being. Scientific research over the past few decades has shed light on the complex relationship between masturbation and men's health. Daily masturbation, once a taboo subject, is now being studied seriously in clinical and epidemiological contexts. Some studies suggest that regular ejaculation may offer protective benefits against certain prostate conditions, particularly when done in moderation. However, excessive frequency or compulsive behavior may lead to different outcomes. One of the most debated areas is its connection to prostate cancer. A well-known study from Harvard found that men who ejaculated 21 times or more per month had a lower risk of developing prostate cancer. The theory is that regular ejaculation helps clear the prostate of potentially harmful substances. However, this doesn't necessarily mean daily masturbation is ideal for everyone. Individual context, age, and health status matter greatly. Beyond cancer prevention, masturbation has been linked to several psychological and physiological effects. Research shows that it can help reduce anxiety, promote better sleep, and improve mood in some men. These benefits are often tied to the hormonal and neurological changes that occur during and after ejaculation. Still, for older men, these outcomes may vary depending on their baseline hormone levels and general health condition. That said, not all findings are positive. Excessive or compulsive masturbation, especially when linked to pornography, can affect brain chemistry and lead to issues such as reduced sexual sensitivity, relationship problems, and emotional dependence. Science continues to explore the balance between frequency and health. The key takeaway: masturbation can be beneficial, but like most things, it depends on the context and the man behind the habit. The idea that there is a perfect frequency for masturbation is more myth than science. While some studies hint at benefits from frequent ejaculation, science has not established a universal rule. What is beneficial for one man may not be for another. Factors such as age, hormone levels, relationship status, and emotional well-being all play a role. The real question isn't how often, but how does it affect your health and life? There's also a key distinction between masturbation and sexual activity with a partner. Intercourse tends to involve emotional connection, physical intimacy, and reciprocal stimulation, all of which influence hormone release differently. Masturbation, especially when done in isolation and with the aid of pornography, often lacks these elements. For older men, understanding this difference is crucial, as it may impact both physical health and emotional satisfaction. Prolonged abstinence is not necessarily harmful, but it may lead to physical symptoms like pelvic tension or even mood shifts in some men. On the other hand, masturbating excessively, particularly out of boredom, stress, or compulsion, can lead to fatigue, reduced libido, or a decline in social motivation. Both extremes can create imbalance. The key lies in observing one's own patterns and how they align with personal well-being. Ultimately, the science suggests that there is no magic number. Some men may feel energized and focused with occasional ejaculation, while others might benefit from more regular release. The healthiest approach is personalized and mindful, grounded not in guilt or cultural pressure, but in how the practice fits into a man's overall lifestyle, health goals, and emotional balance. While the conversation around masturbation often centers on risks or taboos, there are lesser-known benefits that deserve attention, particularly for older men. One such benefit is the reduction of pelvic tension. Regular ejaculation can help relax the muscles in the pelvic region, improving comfort and even posture over time. For men who sit for long hours or have chronic tension, this can be a meaningful, natural form of relief. Another overlooked advantage is early detection of abnormalities. Through regular self-exploration, men become more familiar with their own bodies. This awareness makes it easier to notice unusual lumps, pain, or changes in function, signs that may point to underlying prostate or testicular conditions. In this sense, masturbation doubles as a form of preventative health check, especially valuable for those over 50. Circulatory health also plays a role. Ejaculation improves blood flow not just in the genitals but in the entire pelvic region, which can support hormonal balance and reduce inflammation. Healthy circulation is crucial for testosterone regulation and overall vitality. In older age, maintaining proper blood flow helps counteract many of the natural declines associated with aging. Finally, masturbation, when practiced mindfully and without shame, can help maintain a sense of autonomy and dignity. It's a way for men to stay in touch with their sexuality in a safe, private, and controlled environment. This psychological aspect often goes unspoken, but it can significantly affect confidence and quality of life, especially for those who are single or experiencing health-related intimacy challenges. While moderate masturbation can offer benefits, excessive or compulsive behavior introduces risks that many men, especially those over 40, may underestimate. One of the most concerning issues is pornography-induced erectile dysfunction, PID. When masturbation becomes strongly linked to pornographic content, the brain's reward system adapts, requiring more extreme stimuli for arousal. Over time, this can dull sensitivity to real-life intimacy, leading to performance issues and emotional frustration. Another subtle consequence is the decline in social motivation. Some men begin to replace real-world social and romantic connections with solitary habits. The brain, satisfied by frequent release, reduces the drive to seek out companionship or invest in relationships. This behavioral shift can lead to isolation and decreased self-esteem, particularly for men in transition phases like divorce, retirement, or empty nest life. Cultural or religious guilt may also play a role. In many communities, excessive masturbation is accompanied by feelings of shame or moral conflict. This internal struggle can become a cycle. The act brings temporary relief, followed by guilt, which in turn leads back to the habit for emotional escape. This pattern can erode mental health, creating anxiety or depressive symptoms that further complicate the situation. Understanding these risks doesn't mean vilifying masturbation. It means placing it in context. Like any behavior, when it becomes compulsive or interferes with daily life, it deserves attention. Men should not hesitate to seek guidance if they find themselves struggling with control or emotional distress tied to the habit. Proactive awareness is the first step toward healthier, more balanced sexuality. As men age, their hormonal landscape shifts, and with it, the way their bodies respond to sexual stimulation. Testosterone levels, which peak in young adulthood, gradually decline after the age of 30. This decrease affects not only libido but also energy, mood, and even the quality of erections. What might feel natural and effortless in youth becomes more nuanced with age, requiring more awareness and intention. In adolescence and early adulthood, masturbation is often driven by high hormone levels and curiosity. It serves as a natural outlet for physical and emotional development. In this phase, frequent ejaculation rarely presents health concerns. However, the same frequency in later years may not bring the same benefits. In fact, it could even lead to fatigue or hormonal imbalance if not managed properly. For older men, especially those over 50, masturbation can take on a more health-focused role. Regular ejaculation has been linked to lower risks of prostate inflammation and possibly even reduced cancer risk. It also helps maintain erectile function and pelvic health. However, balance is key. Unlike younger men, older adults may need to consider the quality and context of their sexual habits more carefully. It's also important to acknowledge that sexual needs evolve. A man in his 60s may value emotional intimacy and physical comfort more than pure frequency. Masturbation can still be part of a healthy routine, not out of habit or compulsion, but as a mindful practice that supports well-being. Adapting to these age-related changes is not a loss of vitality, but a sign of maturity and self-knowledge. Many men delay medical consultations, especially when it comes to intimate health concerns. However, knowing when to see a urologist can make a significant difference in long-term outcomes. Warning signs such as blood in the urine or semen, persistent pain in the pelvic area, difficulty urinating, or sudden changes in sexual function should never be ignored. These symptoms may indicate serious conditions like prostatitis, benign prostatic hyperplasia, or even prostate cancer. Routine checkups are equally important, even when no symptoms are present. After age 50, or earlier for those with a family history of prostate issues, regular screening becomes essential. Tests like PSA, prostate-specific antigen, blood work, digital rectal exams, and, if necessary, MRI imaging help detect problems early, often before symptoms arise. Early detection offers more treatment options and better outcomes. Men often assume that urinary changes are a normal part of aging, but this is not always true. Slow stream, increased nighttime urination, or urgency may signal underlying issues. Urologists are trained to differentiate between benign age-related changes and more serious conditions. Ignoring these symptoms can lead to complications that affect both health and quality of life. Being proactive about urological health is a form of self-respect. It's not just about avoiding disease, it's about preserving energy, confidence, and independence well into later years. A urologist can be a key partner in this journey, offering not just treatment, but guidance and reassurance along the way. Before we go any further, join our channel's members-only club to stay updated on exclusive content, early access to new videos, and real discussions about men's health that truly matter. Now, take a moment to reflect. What if your most familiar habit is silently shaping your energy, your hormones, and even your future? Masturbation isn't just a side activity, it's a signal of how well you understand your body, your boundaries, and your needs. Ignoring it, or abusing it, can carry consequences that show up not today, but years down the road, when they are much harder to reverse. This isn't about fear. It's about clarity. You don't need to quit. You need to observe. Track your patterns. Listen to your energy. Adjust based on how you feel, not on what the internet tells you. And most importantly, talk to a urologist before your body forces you to. Prevention is not weakness. It's wisdom. If this video made you rethink something you do almost every day, then it served its purpose. Now take action. Like the video, subscribe to the channel, and turn on notifications, because your health deserves more than silence.